Hi everyone, this is Dr. Prapti, prosthodontist and implantologist. So, my specialty lies with geriatrics, that is, people above 40 years of age. And the common thing which I hear everybody asking me one thing, अब हम बूढ़े हो गए, हमें दांत की ज़रूरत नहीं, इतना खर्चा क्यों करना, क्यों ज़रूरत है, ऐसे ही ठीक है. But they will be never happy or satisfied with whether their daily life, whether what they are eating, or they are not happy. See, everything has a connection. So what do I mean by this connection? If you don't eat happily, if you don't get the right amount of nutrition, you feel depressed. So it has all these biochemicals running here and there if the balance is not maintained. To maintain the balance, we need to have the right amount of nutrition. How can you have the right amount of nutrition? The nutrition can be rightly achieved if you eat properly. To eat properly, you need to chew well. So for the chewing purpose, you need teeth. So that is the importance of the teeth, even as adults and even as kids, both. So if you see, when the kids are born, they don't have teeth, right? But they don't need that much amount of nutrition in that, for that small tummy. But when we are adults, we cannot live without the teeth. We have, for our stomach space, for our amount of needs of our body, we need to eat, we need to have the right amount of nutrition. So it's all connected. So teeth is must. Even like if you have crossed the age of 50 or you are in your 80s, we need teeth. So replacement of the teeth is important. Now, how would you replace your teeth? If it is you want removable, we can give you removable or fixed options, both. Okay, in case of removable, where all these removable teeth is indicated? Removable teeth is indicated only if there is some constraints from your medical side, in the terms like you have some deficiencies or you have some medical conditions where it is contraindicated to go for any surgical type of procedures to give you fixed. Then we avoid these fixed treatments, and we give you multiple removable options. And there are multiple removable options. You don't need to go with the basics which were there practiced 10 years back or 20-30 years back in dentistry. There have been so much evolution in the options to be given. When it comes to the fixed options, we have two types: whether to use the retained tooth, whichever teeth you have in the mouth, use them and then give you the fixed options, or if you have lost everything, to at least give you something by giving you certain implants. Implants are nothing but some additional titanium screws that we put in your bone, in your jaws, so that we can build up tooth surface area on which you can chew. Those can be also done in terms of a fixed option. But it's and there are a lot of in that also we have lot of options to be given as semi fixed, fixed, or lot options like choices as per the economical scenarios and all. You can go ahead with it. Okay, so choice and options can be given by the dentist to you. Okay, making the right decision for yourself, and the firmness that you want the treatment for your happiness, for your nutrition, is your choice. It can't be forced, it should be accepted. So same with the treatment also. When it comes to a removable treatment, if you have the will that I want to eat my food well and I will use the removable dentures very well, so removable can be encouraged and being given very properly so that you can use it for your chewing purpose. But if you have made a thought because of your previous treatment experience that removable doesn't suit me, then I cannot change it. It's your experience and a perception that you have settled in mind. And as you see that the old patients, they often come with this thing that I had a very bad experience with the removables. I don't think so I'm again pro to go with the removable options. I want some fixed options, not the removable ones. But I cannot get the fixed options done because of my medical conditions or financial constraints. So instead I choose not to wear any of the thing, removable or fixed. That is wrong, because in that term you are doing more harm to yourself than you are doing anything good. So what you need to do, replacement is important. You have to go for removable. We can give you better options and we can encourage you with many follow-ups. From your side, we expect follow-ups. From your side, you have to let us know what the problem is. Where are you facing difficulties? But to put a mind block saying that removable is not possible, that will not help. Removal has to be accepted by you. It is exactly like wearing new spectacles. If you wear the spectacles for the first time, you feel the weight of it, you feel the difference between in your vision. Similar with the dentures. Slowly, with as you see, if you wear the spectacles, slowly you get used to wearing the spectacles, right? Similar with the dentures, once you wear it for a period of time, you get adapted with it, you know how to use it, and after a while, I think the best doctors for the dentures, for the removables, is the patient themselves, because they know what is best for them rather than the dentist. So you become your own dentist once you have a hold of your removable dentures. So go today, meet your dentist and know what is best for you and what works well for you. Thank you.